Welcome to this webinar on Outcome 2, Patient and Public Information. Outcome 2 covers the use of high-quality evidence and knowledge that is mobilised by skilled library and knowledge specialists. Examples you could use for this include your work on patient and public information. This presentation reviews patient and public information activities and where you can find resources to support this work. The Patient and Public Information Workstream is co-led by Ruth Carlisle, Strategic Lead for the Midlands and the East of England, and Sue Robertson, Knowledge Services Development Lead across the South. This presentation has been developed by us jointly and is being presented by Ruth Carlisle. The patient and public information aspects of Outcome 2 build on significant developments by NHS, library and knowledge services. The last 3 years of returns for the Library Quality Assurance Framework, or LQAF, show that patient and public information activity has become embedded in most NHS library and knowledge services. Back in 2016, services had the option of indicating that patient and public information activity was not applicable. In 2017 and in 2018, by contrast, patient and public information was included as one of the 5 core areas on which all services were required to provide returns, and the option of not applicable was not available. The proportion of services that were fully compliant on patient and public information rose from 38% in 2016 to 74% in 2017 and to 80% in 2018. Most NHS library knowledge services are therefore likely to have ongoing patient and public information activities you could draw upon as part of your evidence for Outcome 2. The primary driver for our work on patient and public information is to enable individuals to use the right information to improve health and well-being, for self-care and shared decision-making. The confidence and skills of library and knowledge services staff are the bedrock for this outcome, enabling partnerships with information providers, skills development for frontline healthcare staff, and supporting the wider healthcare system to provide high-quality health information for the workforce to discuss with individuals. Broadly speaking, as you progress through the levels from level 0 to level 4, you'll notice that they describe an increasingly mature model of service delivery. Level 0 reflects an organisation where the library service has not yet developed or isn't yet delivering against this outcome. Level 1 focuses on delivering evidence to an individual and has some understanding of how the evidence supplied can be mobilised and shared. By level 2, there is greater evaluation and analysis of activities undertaken. Evidence is mobilised and used by one or more teams in the trust. At level 3, the analysis and evaluation continues, but the support for patients and the public is widened. Senior stakeholders are involved in evaluating and shaping the patient information services provided. At level 4, the library and knowledge service is embedded in or working at systems or organisational level. You may well be involved in a wide range of activities. We suggest some initial questions to help you to think about your current activity. As starting points, just consider: are you providing evidence for patient information leaflets? What stories did you gather from Health Information Week? Did you generate any impact case studies? How are you increasing health literacy awareness? What partnerships do you have for patient and public information? You may well have activities in these areas or be able to learn from other people's stories. The Ideas Bank on the Knowledge for Healthcare blog site includes activities in which people are already involved. Current activities by NHS Library and Knowledge Services staff include holding an information clinic in your library, with a clinical colleague bringing a group of patients and carers into the library and working with you to show them resources or provide guidance on accessing high-quality information. Sitting on patient information review panels to ensure that current evidence is being used. Running health literacy awareness training sessions and signposting to health literacy resources or materials in accessible formats. Arranging sessions with well-being or health speakers, potentially in collaboration with one of the unions. Sharing links to current health information stories or evidence behind the headlines through your social media feeds. Running health information stalls or organising health information displays, possibly in partnership with local public libraries. The Ideas Bank is one of a range of resources on the Knowledge for Healthcare blog site. The Knowledge for Healthcare resources support activity at individual level and at organisation and system levels. At an individual level, the Ideas Bank, Useful Links and Resources Ideas for Health Information Week provide suggestions to help you to think about materials or your own role in providing health information to patients and the public. At an organisational or system level, some of the examples in the Ideas Bank also apply. Also explore the Making the Case tools, which support stakeholder mapping and provide case studies of influencing activities, as well as an animation to influence others on the importance of evidence-based patient information. We also have partnership tools, such as suggested outlines for Memoranda of Understanding. You may already be involved in health literacy awareness training. We are also developing 1-hour and 15-minute taster options, as well as e-learning with linked resources. The e-learning is being developed with NHS Education for Scotland. Health literacy is one of our priority areas to the end of 2020. Considered in terms of outcomes, individual outcomes could include signposting to content that enables someone to understand information. At a service level, you may have changed signage within the library or made it clear that it's okay to ask. At an organisational level, you may have contributed to wider outcomes, such as increasing the confidence of health professionals or contributing to addressing health inequalities. Some of the opportunities that arise in relation to patient and public information arise on an annual basis. One of the annual opportunities for patient and public information is Health Information Week. Plan your activities so that you can capture the outcomes from your work. Think about this as you prepare for Health Information Week in future years, so that you have new evidence that you can use on an ongoing basis. Finally, thank you for watching. Enjoy exploring the tools, techniques and stories that are there to help you. And if you need any further information, please just get in touch. Thank you.